Hello, my name is Christine Green. I'm a travel health nurse and I'm working on behalf of patientgroupdirection.com. I'm here to answer a few questions to help pharmacists run a travel clinic. I always ask patients if they can get any medical records of vaccination history from their GP or from their parents, if they've got any records at home, if they have a travel card that they've been on future past trips. If this is not available, then just start giving the injections that you think they might need for each country. Hepatitis is combined hepatitis A and typhoid. Typhoid will last for 3 years, so you'd give a booster of typhoid after 3 years. Hepatitis A, a booster should be given within 6 to 12 months, and then they will be covered for 25 years. Then you can boost up to 2 to 3 years. If it's longer than 5 years, then I think you better start the regime from the beginning.
So why is it recommended between 6 and 12 months?
It's to do with the antibody reaction, and you get better cover if they come back within 6 to 12 months. I would always have the phone numbers of NATHNAC and Travax, which have helplines which will cover any questions that you might have. You can charge whatever price you like, but you should have it clearly set out and inform the patient at the beginning of the consultation. If some places do charge a minimal fee of £10, which is for the consultation and for the record vaccine book.
Good. Where do the vaccine books come from?
You can obtain the vaccine record books from GlaxoSmithKline or Sanofi Pasteur. All pharmacists should be trained in anaphylaxis. If you have a patient who is very squeamish or worried about having needles and reports that they could faint, always make sure you lie them down on a couch or have them positioned in a seat. Try and keep them calm, give them a drink of water, reassure them, and if the patient does faint, make sure you have plenty of space around your seat, or if they're on a couch, you should make sure that you raise their legs above their waist. If they're sitting in the chair, put their head between their knees and give them a cold drink of water, reassure them, make sure that the room is well ventilated. If a Muslim woman comes in and she's wearing a hijab, it would be advisable if you could ask her if she would be willing to remove it. You could explain to her that it's good to see whether she's having a reaction to the vaccine. If her lips become swollen, she's hot and sweaty, or becomes very pale, we would not be able to see this under the hijab. If a patient presents to you and they say they're feeling unwell and feel feverish, I would tell them to come back at another time when they're feeling well. If a patient comes to you for advice and you advise them what vaccinations they require and they decide that they do not want them, then you should explain to the patient why you think they need these vaccinations, and if they still refuse, document that you've given them the advice necessary. You cannot force a patient to have vaccinations they do not want to have. It's best if you don't buy your malaria tablets abroad. You're better off buying them in this country where pharmacists know where they've come from and the factory they've been made in. If you buy malaria tablets in other countries, for example Africa or India, they can be out of date or they can be homemade and have nothing in them but sugar. If a patient comes to you and they are over the age of 65, there are various risks which are associated with giving a yellow fever vaccination. Prepare the patient well, explain to them the side effects they might expect, and do a risk assessment of where they're actually travelling. If they're only going to be on a cruise ship and will not be stepping aboard, then they might not need the injection at all. If they're going to be in a jungle area and trekking and be at risk of getting bitten by mosquitoes which carry yellow fever, then you might decide to give the vaccine.